Okay, so mom needs a nursing home. It starts as a phone call. She's fallen, she's stable, and a discharge planner you met 4 minutes ago is explaining that stable and safe are different words. She can't go home. Then a printed list of facilities, and on your first call to the first name on the list, somebody says the number like it's weather. $355 a day. Not the luxury tier. The national median for a private room, $129,577 a year in a country where the median household brings home $83,730 before taxes. And Medicare, the program that has taken a bite of every paycheck you and mom ever earned, built for precisely this chapter of her life, has a page on its own website that says, "Not covered. You pay all costs." 4 in 10 Americans find that out the way you just did, standing in a hallway, holding a list. Here's what nobody in that hallway tells you. The price of the room is the first thing the system keeps quiet. Nobody mentions which of the next 100 days are already paid for, or the one question you should be asking at the nurse's station tonight while she's still in the bed. Nobody explains what's about to happen to her savings and then her house, or that families standing in this exact hallway this week walk out keeping both. They just knew where the exits were. By the end of this, so will you, whether the phone already rang or you can still see it coming. A nursing home doesn't sell a room. An apartment sells a room. A hotel sells a room. A nursing home sells the person who is already awake at 3 in the morning when mom tries to walk to the bathroom on a hip that no longer cooperates. The medication tracked to the hour, the call light answered, the readiness. Readiness has no slow Wednesdays and no closing time because the residents never leave and you're billed for every hour of it, whether it was needed that day or not. That at least is the theory of the price, what the invoice claims you're buying. Whether the money ever reaches that 3 in the morning hallway is a different question with a different answer. At first, though, the system behaves exactly the way you always assumed it would. After a hospital stay, Medicare covers up to 100 days in a skilled nursing facility. Therapy, nurses, a recovery goal. Medicare pays for mom to get better. So the first family meeting is almost relaxed. The care is happening, no bills are arriving, the house is paid off, and this is all clearly going to be handled. The fine print has other plans. Those 100 days only exist if she was admitted to the hospital for at least 3 days, and hospitals increasingly keep patients under observation, which is a billing status, not a bet. Medicare's own page spells it out. Observation time doesn't count toward the 3-day stay, even if you're there overnight. Mom can sleep 3 nights in a hospital bed and qualify for nothing. Even when the days do count, the free ones run out faster than the brochure implied. Day 21 starts a copay of $217 a day. And somewhere around week 6 comes the sentence that ends the era. The facility schedules a meeting and uses the word plateaued. She's not getting better anymore. She just needs help. Bathing, dressing, eating. The system calls that custodial care, care with no medical finish line. And custodial care is exactly what that Medicare page means by not covered. Day 101 or the morning after the plateau meeting, whichever comes first, the entire cost of mom's daily existence transfers, same bed, mid-stay, from the United States government to your family. Before you write the first check, look at who's cashing it, because who you're paying explains what you're paying. 73% of American nursing facilities are for-profit businesses, and on paper, the business looks like a charity case. Across 11,722 facilities, the industry's reported margin was 0.58%, half a cent on your dollar. But 77% of those facilities paid a combined $11 billion a year to related parties, the management company, the property company, the staffing agency that all happen to belong to the same people who own the facility. The building pays rent to itself, hires itself. buys from itself, and books every transaction as a cost. Medicare's own cost report manual describes this in a sentence auditors must love. When you deal with a related organization, you are essentially dealing with yourself. Add those payments back, and the margin runs closer to 9%. The facility isn't broke. It's dressed broke, and the costume justifies every corner it cuts. The corners all have one name: payroll. 66 cents of your dollar reaches care of any kind. 27 cents reaches actual nursing. Mom's share of that works out to 3.85 hours of nursing attention per day, and the other 20 hours are where the call light blinks. The consequences are already in the government's own inspection files. The share of facilities cited for actually harming a resident has climbed from 17 to 27%, more than 1 in 4. And because the facility is a business, it can end like one on any given afternoon. On December 15, 2023, the largest nursing home in St. Louis told its staff at 3 o'clock that the owners couldn't make payroll. The workers walked out, and by evening, about 170 residents, some without their records, some without their families knowing, were on buses to 15 different facilities, wearing what they had on. The building Mom lives in is a machine, and machines can stop on a Friday. So if Medicare is out and the median family can't cover the bill, who pays? Here's the number that explains the entire industry. Medicaid, the poverty program, is the primary payer for 63% of the people in American nursing homes, not Medicare. Medicaid. The standard financial path through a nursing home is the one nobody says out loud at that first meeting. Mom pays privately until she is poor enough to qualify for welfare. The industry's math makes the same journey from the other side. Medicaid pays facilities a median of 86 cents for every dollar of reported cost, which is why the rehab wing, where Medicare pays above cost, gets the renovation and the marketing photos, while the long-stay corridor gets the staffing ratio. When a facility interviews your family, it isn't asking whether it has a bed. It's asking which payer you're going to be and for how long. If Dad is still at home, the collision is worse because her bill and his survival now draw from the same account. The property taxes, the groceries, his own prescriptions, all competing with $355 a day. The rules do carve out protections for a spouse. For everyone else, the door in is called spending down. Mom's assets go to the facility until almost nothing is left, and then the state steps in. And when she applies, the state doesn't just count what she has, it x-rays what she had. Every gift, every transfer, every asset sold under market price in the previous 60 months. 5 years. The tuition check for a grandchild, the car signed over to your brother, inside that window, each one converts into penalty months she must privately pay before coverage starts. The house is on its own slower clock. There is a page on Medicaid's website that most families read for the first time after the funeral, and it deserves to be read slowly now. States are required, not allowed, required to recover what Medicaid spends on nursing home care from the estate of everyone who received it after age 55. While Mom lives in the facility, the state can place a lien on her home. After she dies, it collects, unless her spouse or a disabled child still lives inside. Congress recently tightened the frame. From 2028, the home equity limit freezes at $1 million permanently, with no inflation adjustment, a line that only moves in one direction relative to house prices. However the Rahab chapter ends, day 101 or the morning after the plateau meeting, every family arrives at the same kitchen table holding the first private invoice. The invoices match, What happens next doesn't, because from this month the road forks. Down one side, the savings burn at $8,500 a month, a $10,625 bill against an average Social Security check of $2,074, until the spend down and the 5-year X-ray where a tuition check from 2023 converts into penalty months. And finally, the letter that arrives after the funeral for the house from that first, almost relaxed family meeting. It was never protected. It was just unclaimed. And that's the road for the families with something to burn. More than half of American households past 65 hold zero retirement savings, and the median family in its late 60s is worth about $409,900, most of it with a front porch. Down the other side of the fork, a family with the same mom and the same invoice pays a fraction of all this and keeps the house. The difference between the two roads was never income, and it isn't luck. It's a handful of moves written into public law, and which ones are still on the table for you comes down to one question. Has the phone already rung? Say it rang this week. She's in the hospital right now. Then your first move happens there, today. Ask one question at the nurse's station every single day. Is she admitted as an inpatient or under observation? They're legally required to tell you. After 24 hours of observation, the hospital must hand you a written notice saying so. And if she was admitted and the hospital quietly reclassifies her, the move that erases her 100 days, that's no longer a verdict. Since 2025, under a court settlement called Alexander v. Azar, the hospital has to hand you a change of status notice, and that notice comes with a fast appeal you can file while she's still in the bed. Families spent 13 years suing Medicare for that right. It's yours now, and the hospital is counting on you not knowing it exists. Next, the plateau meeting, because it's coming around week 6. And now you know something that Discharge Planner may not say out loud. Plateaued is not a legal category. Medicare settled a federal case, Jimmo v. Celebius, over this exact word and was ordered to state its own rule plainly. Coverage doesn't turn on whether mom is improving. It turns on whether she needs skilled care. And care that merely keeps her from getting worse counts. When the facility hands you the cutoff letter, and it must arrive at least 2 days before the money stops, the letter itself lists a phone number for an independent medical reviewer. Call it before noon of the day before the cutoff, and here's the part nobody believes until they read it. If you meet that deadline, you owe nothing while the review runs, even if you lose. The appeal is free to try and thousands of dollars to skip, and the facility's own paperwork tells you where to call. Now the money. If the spend down is coming, the rules draw a precise line between burning her savings and placing them, and the difference is the list of things Medicaid never counts. She can prepay her own funeral into an irrevocable trust. She can fix the roof, widen the doorway, repair the car, pay off every debt she has. Each of those dollars is spent on her, stays in the family's world, and never becomes a penalty. If dad is at home, the federal floor for 2026 says he keeps the house, the car, and up to $162,660 of savings before Medicaid asks for anything. Savings above that line don't have to bleed out at $355 a day either. Converted into a Medicaid-compliant annuity, they become his monthly income, untouchable, as long as the contract is irrevocable, pays in equal installments, and names the state as a backstop beneficiary. That's not a trick from a seminar. The 4 requirements are written into the federal statute. And in 4 states, New York, Florida, Ohio, and Rhode Island, there's an even blunter instrument called spousal refusal. He simply declines, in writing, to pay, and Medicaid must cover her anyway, though the state keeps the right to sue him later. And the house, the asset the letter comes for, has exits written directly into the law. If a son or daughter lived in it for the 2 years before the fall, providing the care that kept mom out of the facility, she can deed them the house tomorrow with no penalty at all. That's the caregiver child exemption. And the daughter who moved in after the first stroke almost never knows the 2 years she's already served have legal value. A sibling who co-owns and lived there a year has the same door. A disabled child can receive anything, anytime. Even the state's claim after the funeral is softer than its letter sounds. Recovery programs collect barely half of what Medicaid actually spends on this care. 2 states collected nothing at all. Every state must offer a hardship waiver. And in the states that only recover from probate estates, an asset that skips probate entirely. If the phone hasn't rung, you're standing at the fork early, and your whole advantage is that none of this has to be done in a hallway. This week, have the conversation while she can still lead it, and start one folder, because the application will x-ray 60 months of her finances, and the family that can produce 5 years of statements on demand starts the clock months ahead of the family that can't. This year, sit down once with an elder law attorney. The flat fee costs less than a single week of the room, and what it buys is the 60-month clock starting now while it's cheap instead of the fall when it's everything. The right assets moved into an irrevocable trust, one she doesn't control, which is the price of the protection. 5 years from signature, what's inside that trust is invisible to the spend down and out of reach of the letter. The look back doesn't punish planning. It punishes planning late. It is functionally a machine for transferring the house from families who waited to the state that didn't. Almost every family stands in that hallway sooner or later, for a parent, for each other. If someone shares your last name and half of this decision, send this before the phone rings. And if it's already rung, send it before the family meeting. And if you want the rest of this system mapped before you need it, assisted living, the caregiver economy, the Medicaid maze, subscribe. The room costs $355 a day. Everything you just learned is free.